Other clinicians, most, thankfully, in less distress, are eager to share their responses in various forums. They send emails ranging from, "I inhaled it in one sitting," to, "It's so real that I can only read about 10 pages before I have to put it down for a few hours or a few days to regroup." One physician's spouse said, "I found myself profoundly influenced. I have sobbed listening to every single chapter so far." When the National Public Radio program On Point asked clinicians for stories of moral injury to enliven a show about the concept, they were inundated overnight. And the New York Times turned off comments for their June 2023 article, "The Moral Crisis of America's Doctors," after just 2 days, when more than 2,000 responses flooded in. Most were from physicians, but nurses, nurse practitioners, social workers, and even patients chimed in, frustrated with their experiences either providing or receiving care. The comments fit into a few categories consistent with reactions to other articles on moral injury in healthcare. Stories of personally suffering or witnessing a loved one suffer moral injury, frustration with healthcare's current structure and cost as a clinician or a patient, wistful recollections of what medicine used to be, indignation at healthcare CEO salaries, the inevitable, though infrequent, anger at a privileged class daring to suggest they suffer, and solidarity from people in other fields. Veterinarians adopted the language in 2018, shortly after the piece that I co-authored with my colleague Simon Talbot on applying the concept of moral injury to healthcare appeared at Stat News and went viral. Educators soon followed, and the American Federation of Teachers Union, representing nearly 2 million educators and 200,000 healthcare workers, regularly includes information about moral injury in publications. The organization that Simon and I subsequently co-founded, Moral Injury of Healthcare, has worked with public defense lawyers over the last 3 years to incorporate moral injury principles into their well-being efforts. And architects, frustrated because design elements fostering workforce well-being in new clinic or hospital buildings are routinely scrapped by healthcare clients as too expensive, turn to us for help in making their case. The message of this book, to inspire people from all walks of life to stand up and speak out for better, more humane, and sustainable working conditions, is spreading. Perhaps that is in part because it resonates with the bigger questions we must confront as a society: income inequality, climate change, misinformation, and polarization among them. Until we decide what we as a society want from healthcare, what we might compromise to get it, and whether profiteering at the expense of the most vulnerable is acceptable, we will struggle to find adequate solutions. I'm humbled by and grateful to all the medical professionals who have spoken up against their destruction, and to those who find the courage to do so in the future. Wendy Dean, MD, January 2024, Carlisle, Pennsylvania. Introduction: What Beer and Modern Healthcare Have in Common. Dr. Mike Hilden answered the knock on his front door in the fall of 2012 to find 2 Federal Bureau of Investigation agents waiting to speak with him. The FBI hadn't come to Carlisle, a quiet college town of 20,000 people in central Pennsylvania, for drug dealers or old-school racketeers. They were talking to doctors, nurses, and administrators at the local hospital, tipped off by whistleblowers who leveled fraud allegations at Health Management Associates, HMA, the 4th largest hospital corporation in the United States and the owner of Carlisle Regional Medical Center. Dr. Hilden had been a hospitalist at Carlisle Regional for more than a decade, since before the board of the nonprofit community hospital sold out to HMA. Now it was one of 71 hospitals in a nationwide for-profit enterprise that was being accused of coercing physicians to forsake their medical judgment, to hospitalize patients who didn't meet insurance criteria, to order more tests than their conditions required, and to keep them in the hospital longer than necessary to increase profits. Carlisle, established by Scots-Irish in the mid-18th century, had an early history fraught with conflict. The Carlisle Barracks, now home to the United States Army War College, served as supply headquarters in the Revolutionary War. George Washington reviewed troops there before sending them west to put down the Whiskey Rebellion, and downtown buildings still bear the scars of a 3-day occupation by Robert E. Lee during the Civil War. But since stopping the northward advance of the Confederate Army, the town had been a quiet place. Unfortunately, though the community didn't know it yet, the fight in healthcare over profits, patients,